Welcome to the Explainer. So, have you ever considered that a simple ache in your knuckle, or maybe a swollen ankle, might not actually be a joint problem at all? What if it's actually the body sounding a systemic alarm? We usually just chalk up joint pain to weekend sports injuries or basic wear and tear, but in reality, our joints are these highly sensitive mirrors reflecting the health of our entire body. Today, we're exploring how underlying systemic diseases, from our hormones to our blood, our nerves to our lungs, leave distinct, highly recognizable fingerprints on our musculoskeletal system.
Here is our agenda for today. We'll start with endocrine and metabolic arthropathies, then move to hemophilic and hemoglobinopathy arthropathies, cover neuropathic Charcot joint disease, explore hypertrophic osteoarthropathy and clubbing, and finally, wrap up by connecting the systemic dots.
Okay, let's dive right into Section 1, Endocrine and Metabolic Arthropathies.
Our first stop is acromegaly. This is driven by a pituitary adenoma pumping out way too much growth hormone and IGF-1. So what exactly does that to a joint? Well, it literally causes it to overgrow. These hormones stimulate the cartilage, the connective tissue, and the bone itself. Now, at first, on an X-ray, you might actually see a widened joint space, which sounds like a good thing, right? But it's totally deceptive. This newly synthesized cartilage is highly abnormal and incredibly susceptible to rapid fissuring. This deteriorates into severe osteoarthritis, hypermobile spine ligaments that cause intense back pain, and because connective tissue is proliferating absolutely everywhere, it very often compresses the median nerve, triggering carpal tunnel syndrome.
Now let's look at hemochromatosis, which is a disorder of iron storage. There are some huge diagnostic clues hidden in specific joint locations here. Routine osteoarthritis typically hits the distal and proximal joints of the fingers, along with the base of the thumb. But hemochromatosis, it has a totally unique fingerprint. It specifically targets the second and third metacarpal phalangeal joints, meaning your index and middle finger knuckles. If you see dominant clinical findings and these little hook-like osteophytes in those specific knuckles, that is a massive red flag warranting an immediate check of the patient's iron levels.
The absolutely crucial point here is understanding exactly how that iron destroys the joint in a dual-pronged attack. First off, iron deposits catalyze superoxide-dependent lipid peroxidation, which directly chews up the cartilage. Second, iron actually inhibits an enzyme called synovial pyrophosphatase. Blocking this promotes the deposition of calcium pyrophosphate crystals, leading to a painfully inflammatory crystal arthritis known as chondrocalcinosis. And here is the truly frustrating clinical paradox for us. While we treat systemic hemochromatosis with repeated phlebotomy to remove all that excess iron, draining the blood does almost nothing to reverse the established progressive joint destruction. It's already done its damage.
So we've seen how hormones and iron degrade a joint from the outside in. And, a joint can also be attacked by modern inflammatory immune checkpoint inhibitors or even by its own synovial lining in rare conditions like pigmented villonodular synovitis, or PVNS. But what happens when the very fluid meant to nourish our tissues, our blood, becomes the primary source of destruction?
That brings us perfectly to Section 2, Hemophilic and Hemoglobinopathy Arthropathies.
For a patient with severe hemophilia, just the simple act of a toddler learning to walk and run can trigger spontaneous bleeding into the knees, ankles, or elbows. We call this hemarthrosis. Because they lack intrinsic clotting factors, the blood just remains liquid in the joint, distending the capsule and causing immense pain. But it's really the recurrence of these bleeds that sets off a tragic cascade. Repeated bleeding into the joint space causes the synovial lining to chronically hypertrophy. It turns into this thick, fibrotic mass. Over time, this restricts motion, creates flexion deformities, and ultimately causes a secondary degenerative destruction of the cartilage and bone that looks strikingly similar to end-stage osteoarthritis.
Now let's contrast two very different hemoglobinopathies, sickle cell disease and beta thalassemia. In sickle cell, we frequently see dactylitis, also known as hand-foot syndrome, primarily in infants under 5. This painful swelling is caused by an actual infarction of the bone marrow and cortical bone because those sickled cells are blocking the microvasculature. Conversely, in beta thalassemia, the arthropathy strikes later, usually in young adults in their second or third decade. It typically presents as this symmetric, dull aching pain right in the ankles. The mechanism here is expansion. The body is desperately trying to make red blood cells, causing those bone marrow spaces to widen and cortices to thin out, though notably, the actual joint spaces are usually preserved on an X-ray.
It's honestly fascinating how the marrow itself can dictate joint health. But now let's completely flip the script. We rely on pain to protect us, right? It's our warning system. So what happens to a joint when it completely loses the ability to feel pain? Sounds like a superpower? Maybe. Actually, it's a disaster.
Which leads us into Section 3, neuropathic Charcot joint disease.
When examining a lateral radiograph of a foot affected by this, it's shocking. Notice how the normal, supportive arch is just gone. The bones of the midfoot are totally fragmented, dislocated, and collapsed downwards, creating what we clinically refer to as a rocker foot. This is a classic Charcot joint. Today, we most frequently see this as a complication of diabetic sensory neuropathy, where the patient's underlying diabetes has completely destroyed the nerves that provide sensation to their feet. Let's break down how this builds into an accelerating, vicious cycle. First, sensory neuropathy strips away proprioception, which is your awareness of joint position, and deep pain sensation. Without these protective reflexes, the patient walks abnormally, and that leads to step 2, repeated unperceived microtrauma. Ligaments tear, tiny fractures occur, but because there's zero pain, they don't limp or rest the joint, they just keep walking on it. This leads directly to step 3, rapid bone fragmentation, subluxation, and complete structural collapse. It evolves terrifyingly fast, turning a fully functional joint into a disorganized bag of bones in a matter of months.
Let's move on to Section 4, hypertrophic osteoarthropathy and clubbing. When you see hands with bulbous, enlarged fingertips and these distinctly rounded nails, you're looking at classic signs of digital clubbing. But listen, this isn't just a dermatologic curiosity or some weird quirk of anatomy. When you see this, it should sound a blaring systemic alarm bell in your mind. This clubbing is very often the most visible manifestation of a much deeper hidden condition.
That underlying condition is hypertrophic osteoarthropathy, or HOA. It's crucial to understand that this is a dual-component syndrome. Yes, you have the soft tissue proliferation in the nail beds that gives the digits that clubbed appearance, but underneath the skin, further up the limbs, there is active periosteal new bone formation. The bones of the forearms and lower legs are actually depositing new layers of bone along their outer cortex, making them irregular, thick, and very, very painful.
And here is exactly why this matters, why you absolutely must pay attention to this systemic mirror. Secondary HOA is a massive perineoplastic red flag. It is strongly associated with intrathoracic malignancies, most notably bronchogenic carcinoma. A patient might come in complaining of severe, deep aching pain in their wrists or long bones due to that new bone formation, long before the visible clubbing ever appears, and long before they even cough or show respiratory symptoms. Catching this early clue triggers an immediate search for an underlying tumor or severe hypoxemic lung and heart disease. It can literally save a life.
Let's bring it all together in Section 5, connecting the systemic dots. So, what you should take away from this explainer is that joint pain is rarely just about the joint itself. Each organ system leaves a completely unique fingerprint. Endocrine issues like acromegaly target the cartilage. Blood disorders destroy the architecture through recurrent bleeding or marrow expansion. Neuropathy removes those essential protective reflexes, causing the rapid collapse of the Charcot joint. Pulmonary malignancies signal their deadly presence through HOA. And as we briefly mentioned earlier, even localized tumors like PVNS or modern cancer treatments like immune checkpoint inhibitors can trigger severe inflammatory arthropathies. The joint is quite literally a canvas for systemic disease.
Understanding these connections fundamentally changes how we must view musculoskeletal symptoms. They aren't isolated complaints. They are vital, screaming diagnostic clues. So the next time you encounter a case of joint pain, will you stop at the cartilage, or will you look deeper and ask, what is the rest of the body trying to tell me? Thanks for joining me on this explainer, and keep looking for those hidden systemic mirrors.